reported after a pre-shift press conference intended to encourage vaccinations. Jennifer Buchner organized the press conference and joins us now. Doctor, we appreciate you being with us. You heard the soundbite. Was this a walkout or not?
No, in no way was this a walkout whatsoever. It was not a protest. Walkout, protest, those were never words used. This was a community-driven press conference for doctors to come out and speak to our community and deliver a heartfelt message, urging the community to help us take control of the COVID situation in our community and get vaccinated.
I want to just clear this up, and then we're going to get on to the other issues, including why you had the press conference to begin with. But there's been this accusation that you were saying we're not going to treat unvaccinated people, or we're going to treat the unvaccinated different than the vaccinated. When we saw the headline, it caught our attention as well. Is that true?
No.
Okay.
Completely disturbing. And I would say fake news, false news. We are physicians. We are trained from day one in our careers to take care of patients. We take an oath. It doesn't matter to me who the patient is, what their ailment is. We would never, none of us would ever leave a patient standing out there uncared for.
You know, they say a lie can get around the world before the truth gets its clothes on. What's happened to you and your colleagues since this report?
Yeah, well, since this report, our phones have been ringing off the hook. Other colleagues of mine, same thing. Several have received death threats. People have suggested my license should be taken away. I've received multiple negative Google reviews, and luckily some other physicians have come to our aid. And unfortunately, this was a message that was really supposed to be heartfelt, and it was completely twisted. And I think a complete embarrassment to healthcare workers everywhere. Well,
and an insult, really, because you guys have been really working 18 and 20-hour days for the past 18 months, taking care of all of us. I want to get to that point, because the reason you had this press conference was because of the explosion of COVID in Southeast Florida. Are we at the point where if I have a stroke or I have a heart attack in Southeast Florida, my care is going to be impacted because the hospitals are so full?
Well, I would say two things to that point. So my point, if you heard our press conference, was people with acute medical issues like stroke may be scared to come out and actually walk in the doors because they're so scared that COVID is everywhere. Now, do we have an issue where you're not going to get a bed if you have, another issue or a pressing issue at this time? No, locally, we're not at that point. But if we don't get a grasp on this in our area, the concern was that we would be. So the hope was all of these doctors coming out before their day started. We care for patients in the community. We care about our community. We're a really close-knit community. We wanted to give that message and hope that if someone saw their doctor on screen, it would encourage them to come out and get vaccinated and help us reduce the chances exactly that would happen.
Yeah, you say not yet where you are. We had some doctors on from Louisiana who said it was already happening there, that people who had heart attacks and other issues were not getting the kind of care they needed because the hospitals were so overflowed. Putting these numbers up in terms of case counts in Florida, and we want to be careful when we talk about states with the highest rates of new cases, because there's a very big difference between new cases, new hospitalizations, the per capita rates, et cetera. Are things in Florida that much worse than the rest of the country in terms of hospitalizations? Because we're not hearing that.
Yeah, so I would say, if you pay attention to the news, our public schools are back in session in most places, and maybe that's not the same in the Northeast and other parts of the country. So that's probably a lot of the increase we're seeing. I don't know, again, that we're at the same severity as what you're hearing about in Louisiana. Obviously, there's been a lot of news about Dallas. So even though we have a lot of cases, and our hospitals are full, we're definitely not in the dire needs and short supplies as you hear in some of the other areas of the country.
All right, Dr. Jennifer Buchner from Florida, Buchner, pardon me. We appreciate you coming on, doctor, and talking with us. Thank you.
Thank you so much.
All right. Lots changed in Afghanistan in the past even 10 days, much less 10 years. Take a look back and see if anybody predicted this when we come back.